there is nearly always blood stasis, and we'll see the diagnosis of blood stasis. And as I said earlier, of course, blood stasis may derive from Chi stagnation. It nearly always does. But Chi stagnation by itself cannot cause cancer. Second, phlegm. And we'll see again the diagnosis of it. Derived from stomach and spleen deficiency, usually. Although in the pathology of phlegm is much more complex than simply spleen deficiency. We always usually attribute to spleen deficiency, not transforming fluids, etc., which is true, but there are many other factors. For example, Chi stagnation may also lead to phlegm. And phlegm is characterized usually by big lumps and more soft lumps, like a lymphoma lump would be a classic type of phlegm, or a thyroid cancer would also be a classic type of phlegm. And of course, phlegm is also the pathology of many other types of cancer, for example, in the intestines. Toxic heat is not always there. I would say blood stasis and phlegm, I would say they are basically always there. There may or may not be toxic heat. And as I said, pulse and tongue are very important to diagnose it. The tongue having very many red points, and the pulse being rapid and overflowing, plus other symptoms of swelling and heat and redness. And underlying all of that, there is always a Chi condition. Why do we say there is always Chi condition? For two reasons. One, the deficiency condition often leads to Chi stagnation and to the development of cancer, but also vice versa. The cancer itself will cause a Chi condition, and that's another important difference between cancer and other diseases. That's why, as my opinion, when you treat cancer, you need to have a different thinking than any other disease. And one important difference is that the cancer itself will cause a deficiency, because the cancer cells are using the Chi of the body, Chi and blood of the body.